What we do is provide direct care to patients. That's our focus.
I was with my grandson and we were just playing, and all of a sudden I felt a stroke coming on.
You were dizzy?
And I didn't really realize what was happening. I was so fortunate that I was only just a half mile away from Holyoke Hospital.
Holyoke Medical Center is a stroke center of excellence. We have been providing this excellent care for our community.
If it weren't for the ED and the staff here, who knows what the circumstance would have been.
One of the things that our ER does very well is to recognize patients who are having a cardiac crisis and expedite their care.
There was a patient I just had this gut feeling that something wasn't right. You know, we noticed that she didn't have a pulse, and you just begin CPR, and then the whole team comes together. We all work as a team, and brought her back. The day that she was being discharged, she stopped by the emergency room, because during CPR sometimes you don't realize how hard you're doing it, and I guess I fractured a rib. And I apologized and told her I was very sorry. I gave her a hug, and she said to me, don't be sorry, you gave my children back their mother. So to me, I'll never forget it, never.
More and more patients are seeking Holyoke Medical Center as their point of care. The emergency department is really going to help us to care for those patients. And so we're very excited about the fact that we're going to have a new building to give the patients the very best care.
The Holyoke-Chicopee area has one of the largest mental illness and substance abuse population in Massachusetts. And I think if we didn't have our emergency department and behavioral health services, we would be in big trouble.
The size limits people's ability to really have a sense of privacy, to really have a sense of calmness and relief. It's small. So what we really truly need to do to provide even better care for our patients is look at the physical environment that we're working in. The privacy aspect of the new ER is outstanding. To be able to give behavioral health patients their own area is exemplary. It's what we need for our folks.
Holyoke is absolutely committed to this community and to the people who live here and work here and come here for their care.
Many years ago, almost 20 years prior, a young woman, she was 18, maybe 19, she used to come to our emergency department and she had a medical issue. She was an alcoholic, and I happened to be a nurse on many occasions. She came to thank me because of my perseverance with her, telling her what her future could be, that she could do better. And she wanted to tell me she was well and that she was graduating in a week with a master's degree in psychology. So she could help people that were just like her when she was 18 and 19.
We are one big team.
Everybody always goes the extra mile than what they're supposed to.
So the new ER promises to let us really have the kind of environment that will benefit everyone. We can't do this alone. We need to pitch in and really help us achieve this.
The sound you hear right now, the construction sound, it's more than the brick and mortar that's going up. It's the future.